The Mayo Clinic says that shaken baby syndrome is rare and reporting that there are fewer than 200,000 cases every year. But a Milwaukee mother with a local connection is trying to spread the message about its risks. News 8's Kyle Dimke joins us with her story.
Well, Martha, this beautiful baby girl right here is Finley Olson. This photo was taken less than a week before she died this past January. She was just 6 months old. The cause of death? Shaken baby syndrome, the result of an infant being shaken abruptly, causing trauma to the brain and bleeding into brain tissue. Now, Finley's family is trying to honor her memory by hopefully preventing this from happening to someone else's child.
So it's one of the last pictures I have of her.
Rachel Olson will never forget the phone call she received saying her daughter Finley was being transported to the hospital from daycare. A happy, healthy baby, only a few days removed from her 6-month checkup, it was hard to imagine why she needed to be rushed to the hospital.
She had suffered a fractured skull.
A fractured skull allegedly suffered due to being severely shaken by her babysitter.
Once I walked in that room and saw her laying, this little tiny baby on this giant bed, hooked up to all these machines and monitors and wires, the reality of that hits you that I knew then she wasn't coming home. I just knew it.
Finley Ray died 2 days later. In the 4 months since her death, Rachel and her sister Amanda Denault, a nurse educator at Gunderson Health System, have made it their mission to educate people about the dangers of shaking a child, because what they have found is a surprising lack of education.
So I pulled a bunch of articles and looked at everything from why it happens to who the perpetrators mainly are to what programs there are in other cities and states across the U.S., and then what's done here.
Medical experts say shaken baby syndrome usually occurs when a parent or caregiver loses their temper with a crying baby. But shaking a child is not the way to get them to stop.
If you've done everything that you can, you've fed them, you've changed them, they're comfortable in their clothing, they're safe in their crib or wherever, then it's okay to walk away and you don't always have to fix it.
Rachel and Amanda are working to try to get more information available to parents at the hospital, in hopes that they can educate and hopefully prevent another family from going through what they are.
Losing a child in that way, it literally rips your soul apart.
One of the things Rachel hopes parents take away from her story is to not stay silent. If you see signs of abuse or just see something that doesn't seem right, she encourages everyone to speak up or ask questions. She says after Finley's death, other families said they had issues at that daycare, but had never said anything.
Thanks so much, Kyle. And the daycare provider accused of shaking Finley is charged with first-degree reckless homicide. She has pled not guilty and will be on trial in Milwaukee County in September.